I'm going to be talking about sexual and reproductive healthcare restrictions in California's faith-based hospitals. California has recently declared itself as a sanctuary state for reproductive freedom and transgender rights. And this is in response to legislation restricting abortion access across the country. In 2021 alone, over 100 restrictions were enacted, and 26 states are predicted to ban abortion in the case that Roe v. Wade is overturned. There's also a wave of legislation restricting gender-affirming care for transgender youth. The restrictions are illustrated below. And this has been happening across over half of the US states and is predicted to impact a third of the country's transgender population. And this is important because gender-affirming care is well recognized to improve mental health outcomes, which are recognized to be poor for transgender students who face discrimination in school settings. The bar graph below shows how access to gender-affirming surgery decreases the presence of anxiety disorders and the rate of suicide attempts in transgender youth. In order to protect sexual and reproductive healthcare access, California has introduced a number of bills this year aimed at protecting privacy, expanding the workforce, decreasing costs, and protecting out-of-state people who are seeking access to comprehensive healthcare. This leads to the question, are there additional barriers to accessing evidence-based sexual and reproductive healthcare? One barrier is the presence of faith-based hospitals, where scientific standards can be superseded by religious standards during medical decisions. An example of that is the Catholic healthcare system, which is the most prominent religiously affiliated system in the US, and is controlled by the US Conference of Catholic Bishops, who determine which services are and are not available. This is a quote where they are disavowing gender-affirming care for transgender youth, contrary to the scientific evidence. Faith-based hospitals do not provide healthcare services deemed to be, quote, intrinsically immoral. Beyond gender-affirming care, this includes assisted reproductive technology, which is the primary way in which same-sex couples can conceive, sterilization, contraception, abortion, including to treat miscarriage, and instances of incest or rape. The graph on the right shows the percent of hospital beds owned by the Catholic Church across the US. The number is 1 in 6 across the country and in California. While the presence of faith-based hospitals themselves are not an issue, the lack of informed consumer choice is. This is based on insurance coverage, geographical limitations, awareness, and resources necessary to access those health cares. In order to better understand the presence of faith-based hospital beds in California, us at the Science Policy Group created this heat map to show that the distribution of the faith-based hospitals and the cost borne by the people in these counties is not evenly distributed. A closer look shows the percent of religiously affiliated acute care hospital beds across 20 California counties. As you can see, 5 counties have exclusively religiously affiliated hospital beds, and the presence is quite high across all 20. Another barrier to access is awareness. In a nationwide poll of women whose primary healthcare provider was a Catholic institution, over a third of them were not aware of that religious affiliation. Another nationwide survey found that less than 3% of Catholic hospitals listed the services they did not offer due to religious affiliation on their hospital, and all of these were in Washington. And that is based on a mandate that Washington passed as a law recently. So based on that, I have 2 policy proposals. First, to mandate that hospitals state any religious affiliation clearly on their website homepage and explicitly mention which services are not offered. The second is to create a database listing faith-based restrictions on sexual and reproductive health care so people can know where and where they cannot access. This is important now because the presence of faith-based hospitals is growing due to increasing buying power from mergers and partnerships. The percent shown here in this graph of acute care hospital beds that are religiously affiliated in 20 California counties that we analyzed shows that it was quite stable for the first decade of the 2000s and has dramatically increased since then. Dignity Health is the largest provider of Medi-Cal in California and is a Catholic system, and they have just merged with Catholic Health Initiatives to become the largest hospital system in the country. That's all. Thank you very much.